You know, some medical services are denied more often than others, and many people don't understand why. Hi, my name is Pam, and today I want to talk about 5 services that are commonly denied and some of the reasons denials happen. The first service are MRI and CAT scans. And some of the reasons that these are denied is that conservative treatment was not tried. You know, those are expensive services, and there are more conservative treatments that you can try prior to having that done. So they want to make sure that you're getting those treatments prior to, so that the MRI or the CAT scan will show, you know, that you've tried that and it's not working. Another reason is that the guideline criteria are not met. So there are clinical coverage policies that each state bring out, and that's on their websites. Clinical coverage policy websites that you can access online, and your denial letter will give you a link to that, and then you can go and look and see if it meets the clinical guidelines or where it's not being met. And that should be information that's given to you in the denial letter is the reason why it was not met. And then there's also missing documentation. So it will explain to you that there possibly is missing documentation, and that's an easy thing to, sometimes easy thing to, you know, get. Sometimes it's not. So, you know, speaking with your provider and letting them know, they also get a copy of the denial, so they also know that it was denied. But getting with them and asking them to help you get that information into the appeals department is very beneficial. So the second service that's denied often is surgeries, and the reason is that they may not be medically necessary, or there's no evidence to show that they're medically necessary because the records are incomplete. So there are criteria that are not met, and there's missing treatment history, and that's a big issue with surgeries because, as you know, surgeries are very expensive. The third service is physical therapy, and some of the reasons for that is that there are visit limits. So there are services you can get, like if you're getting physical therapy, you have to reach certain goals, and that's called progress, and there may be showing lack of progress documentation. So make sure that your physical therapy department is sending in the information, and you know that you're making progress in your goals, and make sure to let them know that you're making progress. That way you can get more visits authorized. And because your authorization will expire, there's so many, you get a certain amount, and then once those visits are done, you have to reapply for more visits, or your physical therapy department will apply for more visits. And if you're not progressing in your goals, then they're not going to approve more visits. But if you are, then the therapy department really needs to show that, so that in documentation, so that you can get some more visits. The fourth service is durable medical equipment, and examples of that are like wheelchairs, CPAP machines and the equipment that go with it, braces, those sort of things. And the reasons that those are denied a lot of times is that there's insufficient documentation. There's coverage limitations, and there's missing provider notes. Also, one of the big reasons that we see that those are denied is that the provider gave the service without prior authorization. So in other words, if you are in the hospital and you get discharged and you need a wheelchair, they bring you out the wheelchair before they ask for that service, before they ask for that equipment, approval for that equipment. So that would be called a prior authorization, and they didn't get the prior authorization for that service. So that's going to get denied. But the good news about that is that's on them. That's not on you, because they're the ones that should have asked for the service. And if you have a doctor that asked for that for you, then you know, you should be able to get it. They'll be able to put in another request after so many days after the denial. So, you know, also coverage limitations. There's limitations on some things, like you may be able to have the wheelchair rented and rental for so much time, and then, you know, the insurance cuts off the amount of time you can have it because of the standards of the documentation and the criteria for the insurance, you know, through Medicaid and Medicare. Another service is medications, and there's reasons that they're not met. There's many reasons why they're not met, and one of the biggest reasons is prior authorization, as I was saying with the durable medical equipment. These medications require prior authorization, and that means that the provider, the person that's prescribing, the prescriber, has asked for authorization to provide that medication prior to you getting the medication. So make sure that when you have a medication like that, that the provider is putting in a prior authorization for it. There's also step therapy, so there's things that step down, and you have to follow those regulations. And there's also formulary restrictions put forth by Medicaid and Medicare. So there are certain medications that are not on the formulary, and they will not pay for them. So be sure that if that happens, you can actually call your provider and ask them to give you one on the formulary, exchange it for one on the formulary. There's also missing treatment history, so they may not be able to give you prior authorization because they can't find in the history where you need that medication. So if that happens, you can ask your provider, or you can ask your other specialist to send in information that would back up your need to have that medication. So in closing, I just want you to understand why denials happen, and that can help people know what information may still be needed during the appeals process. If you have any problems with it, you can always call your provider, or you can call the pharmacy. You can call the appeals department and ask them why your medication was denied, and appeal that if you feel like it was unnecessarily denied. Hey, if you like the information that I'm giving you, could you please like and subscribe to my channel? I appreciate it very much. Thank you, and have a good day.